Addiction is a growing problem in today's society, affecting millions of people. But why does addiction develop so easily? We're going to look at the real experience of a man who struggled with addiction for many years. His name is Marvin, and in his youth he consumed, like many young people, everyday drugs like alcohol and weed with his friends. His casual relationship to drugs quickly changed when he moved to a new neighborhood, where in one nearby house everyone seemed to use heroin regularly. One day, after a fight with his dad, Marvin decided to try heroin with his friends to free his mind. From that point on, he started using heroin regularly. But does that automatically make Marvin a drug addict? First, we need to have a look at what addiction actually is. In medicine, there's a distinction between two types of addiction. The first one being non-substance addiction, also called behavioral addiction. It includes addiction like gambling, food addiction, or phone addiction. The second one is substance addiction. Both share the characteristic that individuals experience a loss of control over their behavior, often accompanied by financial difficulties and behavioral disorders. In many cases, this even leads to severe disruption of personal life, including broken relationships and job loss. Although in both types similar reward circuits are involved, substance addiction is classified as a brain disease because the substance changes the brain pathways, which leads to uncontrollable drug use. Therefore, withdrawal symptoms are usually much worse than for non-substance addiction. The concrete definition of substance addiction is defined by the International Classification of Diseases as a neuropsychiatric disorder characterized by a recurring desire to continue taking the drug despite harmful consequences. Recognizing addiction as a disease by itself was a huge step towards also recognizing the struggles which addicts deal with, because back then it was often referred to as a lack of motivation or a disease of the will, and even sometimes as moral failure or lack of strength. And now we can say that Marvin would not be considered an addict because so far he has not consistently taken the drug despite negative consequences. However, after 6 months of occasionally heroin use, Marvin's father died by suicide when Marvin was only 18 years old. To cope with the pain and grief, Marvin turned to heroin. The heroin relieved his pain and made him forget his struggles. Heroin induces intense euphoria, makes you feel detached from reality and pain-free, therefore perfect for Marvin's situation. From then on, he developed an addiction. He sold everything he had to pay for opioids and lost contact with his family. But how do these effects even occur? What does heroin do in the brain to make you feel that way? Opioids, like heroin, affect the entire central nervous system. It acts on the reward pathway in the brain, like most drugs, but additionally, it also numbs the pain on spinal cord level, so the whole body is affected. Usually, opioids are released by the body itself to weaken pain. For example, if you hurt yourself on your finger, the pain signal would be transported through the entire central nervous system, where at multiple steps the body would reduce the pain sensation. This is possible because opioid receptors can be found everywhere in the nervous system. Heroin induces this exact process, with the exception that usually there is no actual pain to take care of. Heroin acts as an agonist, meaning it mimics how native opioids from the body would behave. Heroin is directly injected into the blood flow, pumped towards the brain by the heart, and then it can cross the blood-brain barrier quickly, as to why its effect is also so quick and strong. Opioids can act in two different ways. Either it induces a presynaptic inhibition or postsynaptic inhibition. Here we can see two neurons. Both of them have G protein-coupled opioid receptors. Heroin would bind onto the opioid receptor, which results in the G protein to split, and one subcomponent attaches to a nearby ion channel. This happens in pre- and postsynaptic inhibition. For the presynaptic inhibition, the G protein would block the voltage-gated channels of the presynapse. Calcium is at this point outside the neuron, in the extracellular space. If an action potential arises and calcium cannot enter, the neurotransmitter cannot be released in the synaptic cleft. Therefore, no signal is transmitted. In the presynaptic neuron, the mechanism is similar, but here the G protein subunit binds to the potassium channel, causing them to open. As positive potassium ions leave the cell, the membrane potential becomes more negative, which prevents the neuron from transmitting the signal, even if a depolarization occurs. This is how opioids act in general on synapses, but they can do that at multiple points in the body, with each a different outcome. In the brain, opioids act on the reward pathway. This pathway is evolutionarily very important because it reinforces behaviors that are essential for survival, such as eating and physical activity, by making us feel happy. The reward pathway is quite complex, so to simplify it, we're only going to concentrate on the mesolimbic pathway, which releases dopamine. The ventral tegmental area releases dopaminergic neurons to activate the nucleus accumbens, which spreads dopamine into further brain regions to induce the feeling of euphoria. Usually, the dopaminergic neurons are tightly controlled by GABAergic interneurons, which basically stop the ventral tegmental area to release too much dopamine. But these GABAergic interneurons have opioid receptors, so when opioid binds, they cannot control the release of dopamine anymore. So on a synaptic level, this would look something like this. The synapse with the yellow circles represents a neuron which releases dopamine, but the nearby neuron on the left releases GABA, which in turn blocks the yellow neuron from releasing dopamine at all. Heroin would block the GABAergic neuron by binding on it. As you can see, no GABA can stop the dopamine release anymore. The dopamine accumulates in the synapse and binds onto the postsynapse over and over again. This results in an intense feeling of euphoria, which is a lot stronger than any naturally induced feelings. The second way of how opiates can affect our body is to reduce pain. Here we can see how the ascending pain pathway, which is colored in green, goes up from the body to the brain, where it's connected to a chain of descending neurons. Usually, when we perceive pain, the pain signal is transported from the primary sensory neuron to the secondary sensory neuron, which sends the signal to the brain where we perceive the pain. From there on, the signal is transmitted to opioid-releasing neurons, which sends opiates to the GABAergic interneurons, such that GABA inhibits the pain signal at the primary sensory neuron. This way, the pain signal won't even reach the brain anymore. Opioids bind onto the GABAergic interneuron, which stops the pain relief even when there is actually no pain. This results in a feeling of numbness. Not every drug acts the same way. For example, cocaine can only act on the presynapse, where it directly blocks the release of serotonin. Now we know how opioids like heroin act in the body, but still the effect is different for everyone, and some people seem to be more prone to addiction. Why is that? A lot of factors play a role when it comes to developing addiction, and gene factors account for 50% of that. So far, around 348 genes have been identified that are linked to addiction development. These genes mainly encode for certain receptors and influence how the drug affects your brain. Life experience can change your genes, called epigenetics, and therefore increase your risk of developing addiction as well. Individuals who take drugs during adolescence develop an addiction easier because their brain is not fully developed yet, and the reward pathway is extremely active during early adulthood. Early childhood factors can result in development deficits. For example, social deprivation during infancy may result in impaired brain connection, which again makes it easier to become addicted. People with mental disorders have genetic factors which influence their stress reactivity, making drugs more appealing for them. In Marvin's example, we can say that the early exposure to drug may have affected his addiction development, but also the trauma and the unresolved grief from his dad's death, as well as the social environment, must have had a large impact. Marvin stayed in addiction for 25 years. He tried getting clean regularly, but relapsed many times. The reason for that can be explained by tolerance. Tolerance describes when the brain gets used to the drug. The consumption of a drug results in a very strong sensation of happiness by activating the reward system, as we have just seen. Depending on the individual factors, some individuals are very prone to continue taking the drug. This continuity changes the brain's connectivity, also called neuroadaptation. The number of dopamine receptors decreases because the brain wants to encounter the strong signal transmission induced by the drug. Therefore, the signal transmission becomes weaker. At the same time, the connections become stronger between the neurons due to the continuous signal transmission, but still less dopamine is released and also necessary now for signal transmission because the brain adapted to the drug. During and after drug use, the brain activates the stress system because it tries to counterbalance the excessive dopamine levels, but the stress system stays hyperactive even when the effect of the drug wears off. In order to erase the negative side effects of the stress system and the decreasing effect of the drug, individuals increase the drug dose, which starts the circle all over again. The level of stress is where many former drug addicts relapse. Their association with stress and drugs makes it difficult for them to cope with the stress in another way. The craving sets in as soon as they are faced with high stress levels. Generally speaking, there is not one cure for drug addiction. Treatment includes therapy and developing self-regulating skills to identify underlying patterns and develop healthy coping mechanisms. There are also some medications on the market for certain drug groups, which make the use of drug unappealing, but these medications do not work for everyone.